In the wake of one of the most devastating moments in Haiti's arduous history, there has been a bright spot. 1 week after Haiti's president was assassinated, the country's first shipment of COVID-19 vaccines finally arrived. President Jovenel Moïse was shot a dozen times in his private residence on July 7. Despite the political chaos, social disruption and a national state of siege that followed the killing, Haiti has now launched a mass COVID-19 immunization drive for healthcare workers and people over age 65. Haiti is one of the last countries in the world to make the vaccine available. The big question now is whether Haiti can overcome the political instability and high levels of distrust among the general public to actually get people vaccinated. But some health officials are optimistic. It's a huge boost for us, says Dr. William Pape of the recently arrived vaccines. He is a veteran physician who has been on the front lines of Haiti's HIV, AIDS crisis and co-leads the country's efforts against COVID-19. Earlier this year, Haiti shrugged off 2 offers of doses AstraZeneca, first from India and then from COVAX, the global vaccine sharing program. Case numbers at the time were low in Haiti, and COVID-19 wasn't high on the list of concerns for Haitian officials or even many residents. But after cases started to surge in May, health officials in Port-au-Prince decided to move forward with efforts to launch a mass immunization program. And in mid-July, the US sent 500,000 doses of the Moderna vaccine through COVAX to the Caribbean nation. It's an excellent vaccine, says Pape. We are very happy to have it. The medical facility that Pape runs, Gheskio Hospital, is surrounded by the social ills that plague Haiti. The hospital sees roughly 2,000 patients a day, from kids with fevers to HIV patients, but it backs up against Village-De-Dieu, or City of God, a lawless neighborhood between Port-au-Prince and the Bay. Over the past 2 years, Haiti has been hit with a significant surge in gang violence. Criminal organizations have taken over entire neighborhoods of Port-au-Prince. After driving out the police, gang members now loot, extort, kidnap and, at times, even kill with impunity. The area has become so dangerous that my driver didn't want to go there, and the hospital no longer opens its gates on the side that faces Village-De-Dieu. Across the street from the hospital, it looks like a war zone. As Pape walks through the compound, I ask him if all those bullet pockmarks are new. Yes, that's correct, he says, as if I had asked about the weather. Shooting happens all the time. Without skipping a beat, he points out the courtyard of his tuberculosis clinic. Moïse's assassination sent a chilling message about the breakdown of the rule of law in the country. It's a very sad time for the country. Very, very sad, Pape says, shaking his head. If the no.